Welcome to the Alternative Dog Moms podcast. I'm Kimberly Gauthier, creator of Keep the Tail Wagging. I've been blogging about raw feeding, pet wellness, and life as a crazy dog mom for more than 10 years. I've seen massive improvements in my dog's health since I began raising my dogs naturally, and I'm passionate about sharing my experience to help other pet parents.
I'm Erin Scott from the Believe in Dog podcast. For more than 10 years, I've been researching and learning everything I can about healing cancer, allergies, autoimmune, and mystery illnesses in both my dogs and myself. And I can't wait to share with you everything I've learned in case it could help you too. As the Alternative Dog Moms, Kimberly and I are bringing you all the latest dog health news that we're following and the brilliant people we're meeting along the way. Now let's get started. Kimberly!
Yes.
We have an amazing guest today. It's one of my favorite people to bring on. And she is one of only 4 board-certified integrative oncology veterinarians. And you know, oncology, cancer is a topic very close to me personally, as well as with my dogs. And we have Dr. Kendra Pope. Welcome. Thank you so much for being here.
Thank you, Erin. Excited to be with your community again.
I have so many questions. I always have so many questions.
Let's do it.
So I feel like over the last couple years, this field, the diagnostics field in veterinary care has really exploded, but particularly a lot of even the at-home testing, which is like very cool because it can feel very empowering if your vet doesn't, want to do something or doesn't have access to do something. But I mean, these things, the costs can add up very quickly. Like you can't do them all. And so if I have an old man, there's a chance he may have a mast cell situation going on.
Mm-hmm.
Are there tests that you recommend on your own that we can do or that we should do from a vet perspective? Or what's your thought on all of these tests?
Yeah, it's such a big question, and it's so true. And I think that there's still a lot of pet owners that don't even realize how much they can do on their own. And I'm so excited that so many of these companies are doing the direct to consumer. This really exists on the human side already. You can order labs yourself. You can get them to your home. You can do finger pricks, all those kinds of things to really take control of your health and be your best advocate. And I love that they're allowing pet parents to do that too, because frankly, and to be completely transparent with you, most of the veterinarians don't even know these tests exist and they don't have any idea what to do with the information. So even if they were doing them, or these companies would allow you to do them at your vet, they wouldn't know what to do with the results. And so it wouldn't be very helpful to you. So I love that these companies are going straight to the source, to the pet parents, giving you information to make, changes and choices, and just get more data, right, about your pet and what you should be doing for them. Because we know everything about my mission is individualization and personalization, and that's how everything works the best. So when it comes to, which tests are best, let's say that it's an ideal world and we could do everything if we spread it out over time. That's usually what I suggest to do, because there is a place for all of those pieces of data: the microbiome, the inflammatory markers, the nutritional markers, the toxins. There is a place for all of them. And so in an ideal world, and in my clients where we are obviously trying to be mindful of cost, what I usually recommend doing is we just spread it out over a year or 2, if you have a young animal. If you have a senior, a pet that you think might have cancer, maybe a more serious condition, it kind of depends on what's going on with them, and that'll help guide you. If they have allergies or chronic GI issues, definitely microbiome testing. If they are having issues maybe with certain medications or have autoimmune or cancer, probably digging into toxins and inflammatory markers. So really just looking into what it is that's going on with them and what you're trying to achieve. But all of them serve really, really valuable different resources and different pieces of information for you.
That's really helpful to know. And also that there is a place for all of it, and especially I have this young girl here, we can take our time and check things out and do it over time. Yeah.
Yeah, for sure. And if it takes 18 months, 2 years to get through all of them, that's okay, right? Because she's fine. So the whole goal is just catching things early before they are causing a problem.
So you had a conversation with Poppy last night, and that was awesome. And you touched on something that over the last year or two, especially because I have adopted this girl, she's a much more intense dog than I've had in the past, and it has changed up some of what I do activity-wise with her. We're dabbling in dog sports and things like that because she's a dog that needs outlets like that. And you talked about Zach Bush, who that's the founder of Ion Biome,
Yeah.
correct?
Mhm.
And that he had a quote about, I'm paraphrasing probably very poorly, but something around, we're living so far away from what we're supposed to be. And that's what creates like the rise of like the biohacking is like we're trying to replace what used to be natural things for us by like kind of like artificial means or something. Do I have that anywhere near correct?
Totally. Yeah, that's exactly it. Yep.
And, and there's a dog trainer, and I'm gonna put a link for everybody listening. If Kim Brophy is not on your radar, I would encourage people to check her out, and she talks about, the different basically, like, that our dogs need to fulfill their
Mhm.
purpose, right? Like their genetic purpose. And, if you have a retriever, they should have some sort of, opportunity to retrieve, and I have a pit bull terrier and she's very heavy on the terrier, and she likes to have opportunities to do that, and so it was like really quickly like kind of obvious to us like, oh, this dog has different needs than other dogs we've had in the past. And so is it causing stress that can affect our dog's health when we're not giving them opportunities to really be the dog that they're supposed to be? Like, do you look at that as part of the reason we have so much illness with our dogs?
I think that it's hard to deny that it plays a role. And, to what degree it impacts health, it's like the same as so many of us would argue now, right? Like so many of us spend so much time indoors on computers, disconnected from community, trying to do everything by ourselves. And there's so much chronic stress in our environment. And we know that that's related to chronic disease for people. And so if we think about that from our animal perspective, you probably heard last night, Aaron, when we were talking, I think it's really easy to see the detriment that we do to animals like horses, that are really meant to be in herds and, outside together. And if they're, high performance or otherwise, they're kept in, solitary confinement by themselves without other ones. So, same with some dogs, working breeds, things like that. They're couch potatoes. And so, although I can't reference any scientific literature behind that I'm aware of, I don't know how it doesn't. And so I think when we're dealing with pet parents like those that are, in your community and that are looking for resources like the ones that listen to you guys, like they're looking to align with that as much as possible and their optimal state of being. And so I imagine that allowing them to just like you said to fulfill what it is that they were bred to do probably can bring down that chronic stress because I can't imagine that that disalignment doesn't affect the biology in some way.
Yeah, I think of that with behavior problems. It seems like
Yeah.
there's so many dogs with behavior issues or anxiety, and so many dogs that are being medicated for, on like SSRIs or
Yeah.
something, and
Yep.
it's kind of like, I think it's more of like a mismatch of kind of like what we like our expectations of like, oh yeah, they should just like lay on the sofa and we'll like let them out in the yard for a little bit,
Yeah.
and it's like, oh, that, that's maybe not what is ideal for them, and could be causing a stress on them that we're not thinking about, and that stress can, yeah, like also affect physical health.
Yeah, exactly. Because I think sometimes people think of stress as this like overt, obvious thing. You are stressed, your pet is stressed, but that doesn't have to be true. Stress can be subtle, it can be quiet, it can be inflammation, it can be any chronic nervous system dysregulation that you might not be able to witness, or notice. And so I think that it's a really good point that it could be causing changes that we may not be able to see.
Yeah,
Oh, yeah.
I liked your that you guys touched on this idea of kind of like zooming out, like that. Of course, and Kimberly and I talk about this too. Like we're so focused on like physical health, but like it's also, emotional health. It's also letting them, express their dog traits. It's these other ththings too, not just like what supplement should you give or what, flea tick should you do or not do kind of decision.
Yeah. Yeah, and I think of was it Maggie? The dog in I don't know if it
Australia
was it Australia? I was gonna say New Zealand.
or
Um,
one of them.
One of the but, one of the things was that, she was a herding mixed dog, and she walked the farm with her owner all day, every day. And it's really made me take a step back, not so much her story, but all of the stories have maybe take a look back and see what my dogs are doing instead of making them fit my life, sort of adjusting my life to fit what they needed. So back to Maggie, I have my senior girl, 12 years old. She's a herding mixed dog. She does not like going on the leash walks. I mean, she will go, but she's never really been a big fan of them. She likes to explore. So we're blessed to live on 5 acres. So when my dog walker takes the dogs that do love to go on walks on leash, I take her and we just walk around the property, and she just explores, and she looks for rabbits, and she does, and she is doing fantastic, and she's really excited, and she's excited. It's funny because if I were to leash her up and take her for a walk, it's sort of like she looks like an old dog.
Mm,
When I let her be on her own so she can explore, she's running and she's, jumping at things and being she seems a little more spry than
yeah,
normal. And
yeah.
so I think, and it's back to the dog walks. It's not about, me walking my, if I need to go and get exercise, and I just have to walk on my own. But when I'm walking with them, they are going to want to stop and
Yeah,
sniff and check things out. And it makes, if I'm in a hurry and I don't have time to allow them to do that, then we can't go for a walk.
yeah.
And it's it's funny because my partner, explaining that to him, because he just does not understand that, because he thinks we're just gonna go for a walk. And I stopped inviting him to come on to our walks because he just so impatient, and he's just like, "Why are we stopping again?" And it's like, "Oh, yeah, and we're probably gonna stop 700 more times."
Yeah.
And it's like, it will feel like we have walked 10 miles, but we've only gone a mile. But they are fine, and
Yeah.
this is what we're gonna do, and I think it's one of those where I'm surprised at how long it took me to click into that and make that adjustment, because people just weren't talking about it until probably the past, maybe in my zeitgeist, 5 to 7 years.
Yeah. I saw it was like a post about that specifically, that like the blessing of children and animals is that they force you to slow down. And it's
Mhm.
like, isn't that beautiful in itself that we're like, come on, come on, come on, I got stuff to do. And they're like,
Yeah,
no, be present, be in the moment.
yeah.
And they like force you to slow down. And so, yeah, absolutely. They do that much better than we do.
I tend to be more introverted, and Apollo is such an he has friends.
I
And
love
so when I take him for a walk, we have to stop as he catches up with a friend, and it's hilarious because 'cause I'll be walking and I just hear someone going, "Oh, Apollo," and it's just like, I don't even know if these people know my name.
Yeah.
But Apollo knows who they are. He
Yeah.
met a new friend today, a guy who, already knows his name and spent time. Apollo, he got loose from me. I was, like, trying to adjust the leashes and accidentally dropped his leash, and then he went ahead, and I was trying to get his leash, but then he saw someone, and then he was just like, "Hi," and I'm just like, "Oh, here we go." But the guy was there for it. There's a group of teenagers on a local high school track team. When they're doing their practicing in the end of the summer, they will all be like, "Oh, there he is," and it's
That's
just
so
like
funny.
it's just like, but it makes him so happy, and by the time we get home, and he's the best dog. And going back to something that Aaron said, when we got him, he had intense, crazy separation anxiety,
Mm,
and I thought that I was going to have to, medicate him,
yeah.
but he doesn't have any of those symptoms anymore. He is just such
Wow.
a happy dog, and this changed before I started working from home. And even when I got if I have to go for the day, he doesn't not have any problems. He is so perfectly happy, and I credit that to changing my mindset of how I, engage with our activities.
Yeah, because it sounds like he's getting to use his brain in lots of different ways. So that's an awesome testimony to some other treatments for separation anxiety. Because I know
Mhm.
there's a lot of pet owners that are dealing with that.
Yeah.
Yeah, cool.
How often do you talk to when you have, clients come in? Are you talking about, like, things beyond physical, health.
Yeah. Those are the topics that you get the opportunity to discuss with them when you've kind of gotten out of the woods. When you're dealing with a client that's in a really difficult spot with their pet being diagnosed, they're deep in treatment, maybe they're not responding to treatment anymore. Um, those aren't usually the conversations that you get to have with them. But you get to do that when you've known somebody long enough, you've been treating them long enough, maybe they're on maintenance from their cancer program or therapy, and you kind of have that breathing room to say, like, let's talk about some weird stuff. I also get an opportunity to talk about it when clients bring it up themselves. You know what I mean? I get to talk about it in end of life conversations. I definitely talk about it a lot with clients then, because I think that can be such a really hard place for us as pet parents to go through, that like leaning into something bigger can be really helpful. And so I think I do a fair amount, so much more now than I used to. Before it was always like science, data, biology. And now it's like, let's talk about the fun stuff. Because it's all at play, it all has a part in all of it.
And when you look at, like health is more than one thing, like wellness is more than one thing. And, I think like when we come to somebody, we might be like fixing on
Yeah.
the physical, and it's like, well, it can be more than that too.
Absolutely. And it's a part that isn't really recognized, unless you have trainers or behaviorists or other professionals that like that's their wheelhouse, because we often like leave that behind. We leave the emotional, the spiritual behind. And sometimes that's why certain diseases don't get cured, because we're forgetting about other parts of it. So, yeah, for sure.
I certainly appreciate that perspective.
Yeah.
So I'm curious, do you I know you do some consulting work. Like if like I'm in Baltimore, like if my vet, if I had a situation, my vet could consult with you. So do you work with, is it a mix of like integrative versus like, quote unquote conventional practitioners that reach out to you? Or is it like, it's like 95% like integrative holistic people and like 5% like conventional?
Yeah, we find that a lot of our vet to vet consults are initiated by the pet owner. And so a lot of them are integrative or holistic veterinarians, but there's still a good portion that are conventional vets that are just really wonderful and open-minded, and they want to help their client. And their client's like, look, there's this person I would like you to work with. Are you willing to talk to them? And they're willing to get on the phone with, myself or my associate and, hear out what we have to say, do the diagnostics we suggest, and maybe or maybe not do the treatment depending on their comfort level, and if they can or not in their practice. And so I would say it's definitely mostly veterinarians that at least have been exposed to like acupuncture or herbs, but there for sure is a group of vets that they are just really willing to do whatever to help their clients, which I think is really awesome.
Yeah.
Because I was thinking about this, Kimberly, from like the dietary perspective, right? And so I was like curious if you're talking about diet, with people that are like, don't understand a fresh food diet or have
Yeah.
some kind of like resistance to anything other than, the kibble they sell in their practice or something.
Yeah. Yeah, sometimes it is a bit of a dance that you have to do because you're not going to try to like change someone's philosophy. You just want to help the pet. And so sometimes it's just figuring out where you can meet in the middle to be able to achieve that goal. Yeah.
Because we just, Kimberly, of course, sees so much online about, veterinarians that have very strong opinions about what
Oh,
dogs should
yeah.
and shouldn't be eating.
Yeah. Exactly. Yeah, did you guys see that there's like a fresh food hills diet now? My
Yeah.
Yeah.
associate sent it to me and I was
Yeah.
like, "Oh God."
Yeah.
But you know what that I mean, you guys know what that means. That means that they can't deny it anymore. You know what I
Mhm.
mean? They cannot deny it anymore, so they gotta get on the bandwagon because 'cause they're losing money.
I was
So
gonna say they want the market share. Yeah, yeah.
Well,
absolutely.
it's oh, use your words, Kimberly. It's interesting because I expected this to happen years ago. Like back
Gee,
in 2016, I
yeah.
was just sort of like, next year at Super Zoo, someone's going to announce something. And I kept and it was sort of like that was back when they had the freeze dried bits in the
Yes.
bags of kibble. And they were some brands were calling it, you can have a raw food diet, da 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 da. And it's like,
Yep.
yeah, this isn't raw food. But as things progressed, and once we start seeing this, I've noticed that the message has been changing. So it went from, it's not balanced, it's, the pathogens are dangerous, to now they're switching up to you can't balance over time because your homemade diet is going to be missing all of these nutrients without any thought to, well, have you looked at their homemade diet? And then there's also, it switched from, oh, we're worried about, your dog being exposed to pathogens, to the babies and the old people in your home are going to be exposed to the pathogens now that your dog is shedding them. So it's interesting seeing how the message has adapted and adjusted. I don't think a lot of people out there are ever going to be 100% on board with the average pet parent doing these things on their own, despite the fact that there is such a growing community of veterinarians who support the fact that we're doing stuff on our own, and are providing tools to allow us to do this on our own.
Yep.
And also without recognizing that the only reason why we have this type of environment is because we feel that we have been failed, and not necessarily by veterinarians, it's by the entire industry.
Yeah.
It's like it's not pointing fingers. It's just we landed in a space where our dogs are getting sick and our dogs aren't living very long. I mean,
Yep.
and the fact that someone can have, what is it? A mastiff that's 15 years old and still going on daily walks, we're shocked.
Yep.
Or Great Dane, we're shocked. And because they're not supposed to live that long.
Yep.
And then you start looking back to how long dogs lived, and you hear these stories of the longest living dogs.
Yep.
And what's so astounding about these stories is they are not doing anything special for these dogs.
Yes.
They're just allowing them to be dogs, and they're
Yes.
feeding them fresh food.
Yes.
And they're, and it's just one of those where we put so much emphasis on supplements, and we're doing all of these things and trying to keep our dogs alive, when we're forgetting, hey, why don't we just go outside and walk?
And that goes back to exactly what Erin was saying, like just getting back to what they were supposed to be eating, what they were supposed to be doing on a daily basis, the exposures they were supposed to have and not supposed to have, and just looking at it through the lens of, yes, there are things in medicine that are amazing and save lives, and there are things in medicine that maybe have swung too far the other direction, and that we maybe need to dial it back and look at the risks and the true benefits that we have, so that we can make more mindful decisions. So I completely agree. And I mean, it's just, I got the text from my associate today, like a picture of one of the diets, and we both were like, ew, so gross looking. It's like in a tube.
I mean, it's so hilarious because I mean, I've had people reach out to me, or, just come to me because people in my hometown know that, I make my own dog food, and people will be like, oh yeah, I feed my dog this raw food that I get at Costco. And I'm like, oh, so you make, you buy the meat and stuff. And I was like, Costco doesn't sell organs.
Exactly.
And it's like, what are you doing? And they're like, no, it's already in a freezer. It's in the pet section. And I'm just like, Costco doesn't sell. And I'm like, oh, fresh pet. And I don't have a poker face. And I work on that so hard, because for a quick second, they'll see my just Lizzo. And they're like, what? And I'm just like, well, I don't know anything about them today, but back in the day, everyone would open their bag and it'd be filled with mold. So it's just like, I mean, I don't think it's, I don't know. I don't feel comfortable with it. But, it's like you do. To me, it's like, I'm excited to see people wanting to do better, or wanting to, being interested in those things. I'm disappointed that we also have, an industry that, they got, what is it? Shareholders to please, and bills to pay. And so they are going to give us the stuff that we're asking for, but in their way of doing it.
That's such a good way to say it. But I do agree with you. What's the saying? All press is good press. You know what I mean? Like, it's just more exposure, so that an owner who would never see a brand like that would be like, oh, fresh food. And it unlocks something for them to think of it differently. So, it's great. I love it because I think people like we know that the tide is turning and we're just watching the effects of that happening.
Oh, yeah. I mean,
Mhm.
I'm so shocked. Just in the past 2 days, I have been in so many conversations about raw food and fresh food with people who are just have struggle with the concept of it, and it's been years, really, for me at least, that I've had to even engage, maybe, like, a couple times a year, someone will discover my page, and in the comments they're telling me something, and I'll explain, this is what I do, this is what I believe, blah 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 blah, but it's not really that big of a deal. And it's been like, what is happening where um I think so many people, I'm meeting so many people. We interviewed a retired football player
Yeah.
uh, a few weeks ago that started his own raw food company.
That's
And it's the same thing where, he it was this his is the same story that we hear from so many people. My dog was experiencing A, B, and C.
Yep.
And what I love is that those stories are getting out there. And a lot of them, like, I have a dog that has allergies.
Yep.
And she is not on medication because she doesn't need to be on medication. I can
Yep.
manage her allergies with food. And yes, there are gonna be times when she's gonna be itching. There I'm Yes, I have hay fever. There are gonna be times when I'm sneezing. I
Yep.
can't get rid of it 100%.
Yep.
But I loved the idea that more and more people, instead of immediately going to prescription medication, will go to, like, Wolf Creek, where they have the allergy blend,
Yep.
and start trying that and giving that to their dog and giving it a true chance.
Yep. Absolutely. Yeah, it's the I guess, disbelief in any of that having effectiveness, of it not being legitimate, of it being lesser than. Yeah, there's people that they want to take control, and they've seen results through those ways. And I agree with you. It's definitely. I mean, hello, it's what I do every day for a living. Yeah, absolutely. It's great. It's because the thing is that that is the way to health. That is the way to longevity. That is the way to having our dogs and our cats and our pets live longer. And that's what every single one of us wants. It doesn't matter if you're conventional, you're holistic, you're somewhere in between. Like, it doesn't matter. All of us want the same thing. We just want them to live longer. And so it's like being able to find these tools that allow us to increase that health span and that longevity. Like, I'm here for that. So I completely agree. Hmm.
And you have the course, right? About how we can create a lifestyle that's, less likely to create cancer.
Yeah, and that's it's such a good word to choose, right? Lifestyle, because I think that we've all been conditioned in medicine, both in for our own health and for our pets with veterinarians, that you see a doctor when there's a problem. You don't see a doctor to help maintain health, right? That's not why we go to the doctor. We go to the doctor when we're sick. They give us something, we're not sick anymore. But nobody has taught us, and nobody has taught the doctors how to evaluate health to improve it. And so that you have more health and you have more longevity and you have more health span. And going back to your starting comment, the biohacking community has started to uncover that and have that conversation. But cancer prevention is this in the same realm. And although the course is all about cancer prevention, um, if you do the things that prevent cancer, you're going to do the things that prevent all other chronic disease because they're caused by the same thing. It's usually a combination of oxidative stress and inflammation. And so it is just about the lifestyle changes that you can make to optimize longevity and health span, because there are choices we make every day that so many of us don't even realize that we're doing that are affecting that. And that stinks. That's not fair. We should know. And actually, Kimberly, you're the one that said it to me first, like a year or two ago. It's all about that 80/20, and I completely agree with it. But I want to know, and I want all of my pet owners to know, the 20% that you're choosing, that you're choosing them. You're not doing it without being aware that you're making all of these choices that could be affecting health and longevity. So that's where the course came from, is that in order to reach more patients, in order to help more pets, I started teaching the veterinarians how to treat cancer. But that doesn't fix the problem. So we need the pet parents to know how to have the lifestyle so that they can take that into their hands.
You
Mhm.
know, I think of, I'm very specifically thinking of my husband's grandmother and, like, it's just like, "Oh, you just like, it just happened, like, something bad just, like, happens," and it's like, "Well,
Not exactly.
there was, like, you're making a lot of choices along the
Yeah,
way that didn't contribute to, a healthier outcome," you know what I mean?
yeah.
And and there are times where, it is something is genetic, for instance, and there are times when something seemingly happens out of the blue, but there is a lot of stuff that we can do that's in our control, and even as, as pet parents, like, um, there's a lot that we are in control of. It's not just kind of like giving it up to the veterinarian, like, "I just do what I'm told," that was a famous line with his grandmother, like, with the doctors, like, "I just do what I'm told," and,
Definitely. That's such that generation. I completely agree with you. Definitely.
And it's like, well, there's a lot we can do that is in our control and our choices and but it means accepting a level of responsibility that, not everybody's comfortable with. But I
Exactly.
think everybody listening to our podcast is like, please let me, what can I do? What can I control?
Yeah, and you're absolutely right. There is definitely populations of people for their own health, for their animals' health. Like that's just not their priority right now. And that's totally okay. Like we'll be here when you're ready. But for all of those pet owners that exactly like that's what they want now. Like let's, share that information so that they can do more than they think they can. Hmm.
And I'm sure a lot of it comes from you lost a dog to cancer,
Yeah,
and now you're like, "Oh, I wanna do everything I can to prevent it in the next one."
very much so.
It does take a mind shift because it's funny because Johan's my partner, and he was saying that if something ever happened where we split up, he would never be able to have a dog
Mm,
because he cannot do all the things that I do for our
mm,
dogs, and he knows that they need to be done.
yes.
And I think that it's interesting because that sounds like I do a lot. Like I'm just like my whole life is so, obsessed with my dogs. And it's not. It's just a different shift
Yes.
than how I treat my dogs, how I feed my dogs. There's so many little things that I've done that don't really cost a lot of money, don't take a lot of times. I mean, one of the main ones is fasting my dogs.
Yes.
Um, at least once a week, sometimes twice a week, I don't feed my dog or I feed my dogs 1 meal a day, and it's usually one of those where I'm looking at the schedule, like, we went to Canada this weekend, and I was looking at the schedule of I had to go to church, come home, let the dogs out, and then we had to head on to Canada, and I was just like, "There's no time during that period for me to feed the dogs, so they'll eat when I get home." And boom, they have a wonderful 24-hour fast, and my dogs are fine with it. They do great on fasting days, but that's just like one little thing. Doesn't cost any money,
Yep.
doesn't take a little time. It does take some getting used to because when I first heard about fasting dogs, I was just like, "They'll be starving," and my dog gets hunger pukes,
Yeah.
and it's funny because, once my dogs stopped anticipating meals, they stopped having hunger pukes, and I'm not saying that this is the case for all dogs, but that has been the case for all of my dogs. I don't
Mhm.
experience hunger pukes unless they are anticipating a meal. So some days they eat at 11 o'clock, some days they eat at 1 o'clock, some days it's just I don't put a whole lot of thought into it. I just feed them when I get around to it and they're good.
Yeah. What I'm hearing you say, Kimberly, is about like priorities. And I think that's
Mhm.
so true, right? Like you had a value shift, you had, a thought process shift, and prioritize different things differently. Like that's how I'm hearing it. And I think it's so true because, you do hear a lot, and I'm sure you guys hear this all the time, that takes too much time, that costs too much money.
Mhm.
There's always an excuse about why you can't do something, but you're absolutely right. If something's important to you, like you'll figure it out. You'll
Yeah.
figure out the resource that you're willing to sacrifice and how it works for you. And, for me, for pet owners like you, like what else matters if you don't have health? Like there is no other problem. And I think so many people, unless they've gone through an experience where they've lost their own health or they've watched somebody lose their health, like maybe it's just not real to them yet. Maybe it's just not something that requires them to make a shift yet. And so I agree with you. It doesn't have to be complicated. It doesn't have to be expensive, but you do have to have a shift like you're talking about where it's something that you value.
Yeah.
Mhm. Mhm.
And
Definitely.
it's funny how once that starts, how many other little
Snowball.
things creep
Oh,
in,
yeah.
yes.
Oh, yeah. I know. Well, like I was telling you guys before we started today, yeah, I just recently got married. My husband and I just moved into a new home together. And it's like water filters, air filters, this, that, the other thing. And he's like, what is all this shit? And I'm like, you'll be okay.
Yeah.
It's all really important.
Oh, yeah. Oh, yeah.
Yeah.
But yeah, I mean, it's so hilarious, just those things, and what's funny is that I'm very lucky to live where I live and the friends that I have, but the conversations that we'll have where someone will, a friend of mine said that he was like, "Yeah, I had to bury a bunch of bones," and I'm like, "I'm sorry, what?" I mean, what do you mean you buried a bunch of bones? These had better been long, huge, they can't fit into my pressure cooker bones,
Yeah.
because what do you mean? And he just sort of looked at me and he's like, "I'm sorry." And I'm like, "You should be sorry. I could add a freezer full of bone broth." And it's like, "Please call me." The
Yeah.
next time I actually just went up to his house, he just said, "Hey, just go up to my house and go into his shop," and he had a cooler for me just filled with bones, and I went home and made bone broth all weekend, and it's just like, little things like that where that was free to do.
Yeah.
I tell people that all the time. There are so many things that we can do for our dogs that either are free or cost very little money,
Yes.
but people, I think, and I did the same thing when I was new to raw feeding, is you focus on, you're Googling, like, how
Yes.
much does this cost? And everything is expensive. A meat grinder is expensive. A pressure cooker can be expensive, but there's also the Facebook marketplace.
Yep.
There's so many other things. And once you start going down that road, all of a sudden you see it everywhere where it's like, okay, and then that's me. That's my friends always call. It's like, I'm going to throw this away if you don't want it. And it's like, if it's something my dogs can eat, I will take it.
Yep. It's true.
So in your course, do you have a way to help us like kind of prioritize like what we should do? Because I'm thinking, like we have the countertop water filter and we have a
Oh
shower
my gosh,
filter and we
yeah.
have, like all these things. And
Exactly.
like, how does somebody start? And I'm sure that you address this.
Yeah, that was actually it's like the shining jewel of the whole program. Of course, everybody gets a ton of information. I share everything that I know with everybody. But I think what is really important about a cancer prevention protocol is that it's personalized and tailored. That's how we make it really, really effective. Because, thanks to some of my amazing colleagues, thanks to, AI, there's tons of information that's available online. And so we are pet owners don't lack information. They have plenty, plenty, plenty of information. The problem is, well, what do we do with it and what does my pet need? And so the course, after you get through all of the kind of learning in the beginning, takes you through a 150-point questionnaire. And what that questionnaire is doing is it's assessing your pet's risk in certain categories. And then those categories are tied to certain things, whether it's, if detox is needed, or if there's pesticide exposure, or if there's oxidative stress, or if there's, hormonal imbalances. And then once that scorecard's finished, it kind of walks you through what do you do about that and identify those top 3 categories so that you can start, because both health and disease are like onions, right? You have to peel them back a layer at a time because every time you take off a layer, something else is going to pop up and change. So it's developed to be used over and over again. You identify those 3, you take action on those 3, and then, 6 months to a year, you do it again and you change the plan because health biology, it's a moving target. And so it's made to be adaptable and to be able to move with that.
I love that. I'm just thinking when I went on vacation last year, we were going away for 2 weeks, and it was the first time we had ever gone away for that long, been away from the dogs that long, and we had a pet sitter, and I have this whole binder, of everything, and it's like, well, you have to use this
Yeah.
water filter, and you have to clean it with this, and you gotta put the teeth in it, and and it's like just like the water was just like a chapter, you know?
Yes. Yeah, absolutely. But how lucky are your pets that you care about all of those things to protect them? Because they all do affect, and in some animals, in some environments, in some households, they can be really, really, really important and make really big differences. So, absolutely.
Our
Yeah,
dogs are so lucky, Kimberly.
I know. Well, we're both gonna be at Super Zoo this year, so it's like I will have something it'll be on the fridge. I do it every year where I have a chart with each dog, and this is what you have to do, and I try to make things as simple as possible for Johan, and I try to constantly remind myself, if my dogs don't get fill in the blank for a week, it's gonna be fine. It's gonna be fine. They're
Yeah.
going to be okay.
Yeah.
But, I think when Scout was alive, when he had cancer, the chart and it was a colorful chart. I made color-coded chart that was on the fridge that we would check off for that he got this and he got this and to make sure he got what he needed because there were different medications that he got on different days and then different supplements that he got on different days and I had explanations of what it did. And I'm like, Johan is so patient. I mean, it's he's so patient. It's just like, wow. But, a Scout he thrived and he did great and he was a healthy dog. And I'm grateful for the experience and what he taught me. And and I think that, when it comes to a lot of people out there, I know that Aaron and I aren't alone. I don't have a binder. I just have notes everywhere. You open my freezer and everything has like all the food has what's in the food along with a date. So I know what's in it. And because once it's frozen, I don't know what I made.
Yeah.
And so I actually asked Johan if he would paint my freezers with the chalkboard paint
Oh,
so that I
yeah.
could just write on.
That's great.
Yeah, that's a good idea.
I think it's a great idea.
That would be really good. But, like, that's what we just like we said earlier, we're trying to control the controllable. We're not trying to control everything because we have to be realistic and know that there's lots of things that we can't. But the things that we can, that's what we're gonna be in control of. And much like, our grandmothers and everything else, food is love. And these acts are how we love them and show them that we love them so that they can love us back and be with us longer because we selfishly want them to be with us forever.
Yeah. I mean, it
Yeah.
is what it is. Well, and it's also nice when people see the benefits. It's like, I want to do a shout out to one of our listeners who let me know that she, thanks to listening to our podcast, made some changes to her dog's supplements. And she gives her dogs a couple of supplements that we've talked about over the years. And she said her son mentioned that their dog is acting like a puppy again.
Aw.
And it's just like, "Yay, thank you for telling me that." That was just,
Right?
like,
And
so
that's just
soothing.
switching up supplements, you know what I mean? Like, those little changes compound, and they
Mhm,
can become much, much more impactful, and so that's great. It doesn't just like we said earlier, it doesn't have to be expensive, it doesn't have to be
mhm.
complicated. Mhm.
Yeah,
Yeah.
And there's so many tools in the toolbox, and that's what I just, appreciate so much about you and your work is, like, that you're aware of all these tools, and there's, like, a room there's room to use so many different things, and it's like, "Yes, please, I just want everybody to know that, like, there's always so many different options," you know?
Exactly. There's just, biology is complex. And so there's likely more than one, maybe more than two, maybe more than three tools, for each one of them. And so
mhm,
absolutely you need that toolbox that can offer support to all of them.
Like, I
mhm,
guess I'm always surprised at the practitioners that, like, don't want another tool in their toolbox.
Mhm.
That's
Mhm.
the attitude that I'm always like, "But"
Yeah,
it's
you're
like
like
I'm surprised and not surprised. I feel like on some measure, they have so much that they're juggling that they're just like, "Oh my gosh, not something else." Because that's how I kinda feel, is when someone comes out with this great new thing, And I'm just like, "Ah, here we go." I mean, here we go. Gotta give this a try and see what this is about.
Yep.
Uh, but then on the flip side, it's like if it works, man, if you can keep it in your head, like, and address different animals and their ailments with different tools. I mean, I think of, we have a local veterinarian, Dr. Donna Kelleher. She is brilliant at things like that, where it's all up here. And it's just like, it's so astounding.
Yeah.
Just she knows so much. I mean, she's the type of person that can come to your property and walk around your yard and point out medicinal plants that are
That's
just
cool.
growing wild
Yeah.
and what they will do for you and how they can help. And it's just like, if we could get more veterinarians that have that type of mindset,
Yeah.
man, gosh, can you imagine?
Yeah. Yeah, it's definitely a different, and that's why integrative practices don't do well in conventional models, right? In the regular GPs, why they usually tend to have to open their own practices because you guys are describing the difference between the two, right? Like a pill for an ill, quick, keep going, not don't think too much, like here's the medicine for your problem versus like I want to think about this and I can reach for this tool and I can do that tool and I'm going to take time, I'm going to ask questions. And so yeah, the models are very different, and I do think it definitely calls to a different type of person too.
Yeah.
Mhm.
So I was able to attend the AHVMA conference last year, and one of the things I noticed was, at least in that at that specific conference, this is it's only the people that were attending there. Like it definitely like skewed older, like the veterinarian, and I was kind of like, where are the younger people? Like, I thought everybody there would be, like, younger than me, not, like, older than me. And so what do you see, like, about, like, younger practitioners coming up? Are they getting turned on to the integrative side as well?
That's such an interesting point, and you are absolutely right about that. But I will tell you, yes, they are. I actually just had a conversation with a veterinarian who teaches homeopathy maybe a week ago, and she said that the amount of students that are reaching out for lectures is pretty significant. Now, the thing that you guys should know is that less than half of the veterinary schools have any integrative, alternative, holistic curriculum. And so I don't see that changing anytime soon because that's a culture profession thing. But the people in the schools are forming clubs, asking for guest lecturers, asking for people to come and do Zoom meetings. I'm approached by students all the time. And so I think that what has to happen is they have to go through veterinary school, right? And then they either go through an internship or a residency. Then they go to their first job, which probably is all conventional because they haven't been exposed. And then they start to get disenchanted, right? Because they can't fix anything. And so then that's when they start to get exposed to these other tools and then they make the transition. So I do think that there is a lot of interest because they're just like all the pet owners. They're like, wait, why am I feeding this when I could be feeding real food? Right. So they're having the same experience as pet owners themselves. There's just no path for them to get there directly from school and get there during school. Even me, myself, I was exposed in veterinary school, but it took me until 10 years after I graduated. Yeah, almost 10 years after I graduated to be able to start practicing this way because of kind of that path. So I think it's an interesting observation. I laugh because it's true. And it'll be interesting to see how that changes.
I guess I just think, like, today with the benefit of the internet, like, it's
Yeah.
out there, and I think of, the OGs, right? Like, Dr. Rob Silver, Dr. Barbara
Yeah.
Roman, and I'm like, they were doing all this and forming this organization, without the benefit of the internet, you know? And it's like a miracle that they all found each other, and
Yeah.
like that
Yeah.
all these people are able to connect. And yeah, so I'm just like you know, selfishly, right? I'm like, what is the future of this, for like
Yeah.
I'm going to have pets for hopefully another 40 something years,
Yeah. Yeah.
and
Absolutely.
and who will be caring for them?
Yeah. For
Yeah.
sure. Hmm.
Until
That's a
we
good
can get
point.
all the vets to go through your program.
I know until we can get them all doing all the other fun stuff, right? Hmm.
Yeah.
Yeah. It's a great point.
So, it was selfish, I admit.
Hey, that's all right.
I don't think
It's a
it's
great
too
discussion.
selfish either. I
Exactly.
I mean, if you think about it, with the cost of, veterinary care, it's so expensive. I mean, to
Yeah.
take my dog, I mean, we interviewed the founder of Tabati
Yeah.
a few weeks ago, and we were talking about the cost of that oil. And then if you think about, okay, so my dog has arthritis and I need to get my dog on a medication to relieve the pain, I'm going to have to pay, for me at least, $65 for an exam fee, several $100s for blood work, and then, probably another $100 for medication.
Yeah.
And that's going to be like 3 times the amount of the Tavati oil.
Yeah.
And, and it's just sort of like when you think about, and not counting the long-term impact on my dog's liver
Exactly.
because of the medication
Yep.
and what else that will lead to down the line. And it's one of those where I find myself juggling in my head, just, like, where is the priority?
Yeah.
Because is whatever I can do to stay out of the vet's office and
Yep.
only go when I absolutely need to go
Yep.
is, I'd rather take those funds, at several $100s, and invest in my dog's diet and things like that, rather than paying to the vet. And not that vets aren't important, it's just that it's so expensive to go to the vet, that wouldn't it be better if we can start teaching ourselves or learning from people like you how to get ahead of these health issues so that we don't have to spend, hundreds or thousands of dollars at the vet.
Exactly. And that's the point, is that you pay now or you pay later. Like, there's
Mhm.
no escaping it. And so it's like when people talk about, oh, feeding, fresh foods too expensive. Oh, giving supplements too expensive. Oh, there's nothing wrong with my dog. I don't need to do any of those things. Well, it's just like you were talking about, Aaron, with the grandmother. Like, you're going to pay later then, and
Mhm.
exponentially compared to if you paid now, right? And invested in those things. And although we want to pretend like we can avoid that because everything seems fine, that's just not how it works. And so, absolutely taking that money and investing it now in preventative type of processes will pay dividends down the end. Hmm. For
So,
sure.
the topic of vet costs, is something that's like in the media, all the time now, it
Yeah.
seems. How does that impact like an oncology practice, for example?
Yeah. Um, Our practice is a little bit different because, as you could imagine, like a general practice, they get a client when they're a puppy and they have them through their life, right? And they can see them however many hundreds of times in that time period. Whereas we get a client and we see them a lot for a short period of time. And so, our client base has always been a little bit different. It also is, clients are more likely to have insurance or more likely to be, we'll call it motivated to spend, right? Because they're in a crisis situation. And so I think that my practice is just a little bit different than like the general practice because of the nature of what we do. But we have transitioned, and I have hired doctors to be able to kind of capture and move to the more wellness space, right? To do exactly what the educational program is doing, trying to catch them early and help, spread out those costs and prevent these types of diseases down the road. But going back to Kimberly's point, this is exactly why these at-home diagnostics are becoming so popular, because of exactly what you guys are talking about, which is I am trying to save those 3, 4, 5, $600 visits to my vet for when I really need them. Like, they've cut their paw, or they're limping, or they have a fever, to really spend the resources then. But what I would like to do, $100 here, $50 there, be checking things as I go to catch them early. And so, yeah, it definitely has changed a lot. I agree with you, especially since the pandemic, for sure. Mhm.
I guess it makes me feel like, okay, good, we're not crazy because, like,
No, it's
you're seeing
true.
it too. Like,
Oh, absolutely, and I have a really good friend who she's in a very high position in a large corporate practice, and they're talking about it too, for sure. Mhm. Yeah. And, it does affect pet care, right? And access, because not everybody is gonna be like, "Yeah, let me go and spend $500 this week on my pet." Mhm.
Yeah. I
Yep.
mean, we've had a lot of dogs surrender to our rescue because of medical, because they just couldn't afford it.
Yeah.
And thankfully, we have an executive team and a board that is very good at fundraising. So we were able to get um, the care for these dogs. And we also have a senior branch. And the woman that is in charge of that, she and I nerd out on this stuff all the time. And it's just really amazing seeing dogs come into her care that were given a few months to live. And 3, 4 years later, they're still
I love it.
and because she has, she's adapted and she's adopted all of these things. And because of what everyone is seeing with those dogs, it's slowly filtering into other people as well.
Great.
And because I take my dogs to a traditional vet
Yeah.
and they don't go very often, but they go to a traditional vet. And my vets love what I do. And they're so funny because I took my senior dog in for blood work and the vet was waiting for me. I don't remember. I think I showed up not to pick her up because I went with her, but I did something, but he was like, "Oh, I want to go over the blood work with you." And it was just more of a let's nerd out over these numbers and I'm
Yeah.
asking questions and stuff. And he was just got a kick out of the fact that I was interested.
Yeah.
And I wonder how much of there's so many disconnects, I think, within our community. And I think some of it comes from the veterinarian side where they're taught a certain way, they learn a certain way. And also the dogs that they're seeing that are sick,
Yeah.
that's basically what's shaping their mindset.
Yes.
But there's also a level of the pet parents who just aren't interested. We just
Yeah.
just fix my dog.
Yeah.
That's all we care about.
Yeah.
Whereas I bet if there was more of an interest in why we're doing what we're doing and why this is happening, and hey, I have this, because I've shown up randomly saying, hey, I got this supplement because of this, and and they're like, yeah, excellent, I love that one, and we have a quick conversation, and then I bounce out, and it's just like I wonder if we saw more of that type of engagement between the pet parents and the veterinarians, if we could see even more of a shift over.
Yeah. Yeah. I definitely think that there's some veterinarians that when you have that really informed, really empowered pet owner who's advocating for their pet, it does unleash a different dynamic and conversation. So, yeah.
Yeah.
Mhm.
So what's the best part of your job? Is it when you have this dog and then you're able to get, 3 years out of them when they thought they had 3
Yeah.
months?
Yeah. Hearing you talk about Kimberly, the seniors, like they're just my favorites. I mean, who doesn't love a puppy? But like, I just have such a soft spot in my heart for the seniors. I guess that's why I became an oncologist, or maybe it's a consequence of, and yes, of course, helping them to live longer and have that really good quality time with their owners, I think is, there's nothing more like that. But I honestly think the best part is when I call them after they've passed away
Mhm.
and I hear them share stories of, like, what that extra time gave them. You know what I mean? Like, I know, and I'm, like, seeing your face, and I'm, like, welling up with tears too while I'm talking about it. That is really fulfilling because that's all that we want, is we just want more time with them,
Yeah.
and we don't want them to suffer, we want them to feel good, we want them to be happy, and we just wanna be able to enjoy it with them. So when I get to call my clients after their pets have passed away and they share what they were able to do in that time, it's always really beautiful, and I feel really grateful for that.
Oh, yeah. I mean, it does. It means everything. I mean,
Yeah.
because the time I got with Scout was so important to me because I was able to, and same thing with Sydney. She passed from hemangio, and I got several weeks with her when I was told I would only have a couple days. And I needed that time to be
Yeah.
able to let go of her. And same with Scout. I needed that time to be able to be okay with letting him go. But the thing that was most special to me was that I felt like I wasn't in this on my own.
Mm,
So when I was working with a holistic vet and an oncologist, they were in it with me. And it was like when he finished his chemotherapy, like, because it was during COVID, and the
oh,
entire clinic came out to say goodbye to him because they all loved him so much, and they were
yeah.
like, "He's such a good boy," and stuff like that, and they had a whole relationship with my dog that I didn't know about because I wasn't allowed inside, but it meant something for me, and then
Yeah.
he also went to a holistic vet. I trucked all the way down to Seattle, which for people who don't know, that's like an hour and a half drive, for him to get acupuncture, and she would I saw her probably a year or so after Scout died at a acupuncture conference of all things that I was with Dr. Silver. And she came up to me, or I went up to her actually, and was just, to say hi. And she was just like, yes, of course. It's like, and she just started talking about Scout. And it meant so much to me that she remembered my dog. And it was just, oh, wow. It made it all like, if I'm going to go through this, at least I'm not the only one that saw how special my dog was. I mean, because I know all dogs are special, but when we're going through all of that, and it sucks so much when you have a dog that's so amazing, and it's like, why you?
Yeah.
Why can't you be, 17 years old and going through this? Why are you 7 going through this? Or
Yep.
I think he was like 8, but yeah, it really meant a lot.
Yeah, that's beautiful. Thanks for sharing.
Well, thank you for your time today and for all that you shared with us. We're so fortunate to have somebody like you who is, I mean, you're so willing to share and, create courses and put the resources out there. And we want everybody to have the tools in their toolbox. And so we appreciate you for that.
Yes, thank you. And I have some freebies for your audience too. So we'll make sure you guys get the links so that they can do all of that stuff and keep learning and get access. And just like you said, all the resources. So for sure.
All right, everybody, check the links in the show notes. Bye, guys.
Bye.